What is up, Healthcare Squad? Logan here with Healthcare Stress Relief. So you want to quit nursing, or you want to leave the bedside at least, because the bedside is causing massive stress, anxiety, depression. Stick around to the end of this video. I'm going to give you the 20 non-bedside nursing jobs. The beautiful thing about the nursing profession is it's one of the most diverse career fields you can choose, which is a huge benefit for you. I know that you may be feeling like absolute crap right now. You may want to leave the profession completely, but luckily for you, you have many options that many career choices do not have. Like if you are a construction worker, you could probably switch from roofing to concrete, but you're not going to be able to go into construction informatics. And this video right now is more important than ever because so many nurses are leaving the profession. A study in 2014 showed that 33% of new graduates will leave their first job within the first year. I left my first job within the first 8 months. I think this number is significantly higher now, especially with COVID. Anyone working in the hospital as a new grad is pretty much asking, why did I do this? Top of this, a recent meta-analysis of 97,000 healthcare workers across 90 plus countries looked at the relationship between anxiety, depression, and PTSD in healthcare workers. And they found that in all three of these categories, 1 in 5 healthcare workers, or 22% of healthcare workers, are experiencing either anxiety, depression, or PTSD. It's absolutely astounding, and I find it unacceptable. If this is you, I'm sorry that you're experiencing this. But as I said earlier, you are lucky because you are a nurse. You have so much opportunity out there. And if you guys don't know my story, if you're new tuning in here, I'm Logan, founder of Healthcare Stress Relief. I started this business after burning out myself, 2 years in the ICU, developed severe eczema, walked into work one day and hear the news that my coworker Brian committed suicide. And so I ended up leaving the profession, became an entrepreneur, and started this business. The amazing thing about being an RN is you have so much versatility. Myself as an entrepreneur, I've found that so many more doors open because I'm a nurse. There are always people who have been sick or who have had a sick family member. People in society respect nurses and healthcare professionals. Your degree can take you so many places. It's absolutely changed my life and given me much more opportunity. And of course, you have people who are always going to ask you for help. You're going to have the friend who is asking you about the weird rash on their groin. You have an extremely valuable skill set that is versatile. And if you just promise yourself to do a little bit of work and be resourceful, you can find the exact career opportunity that you want. Stick around to the end of this video so you can see all 20 of the careers that are going to fit best for you. And once you do so, go ahead and comment which one you are thinking about getting into, and comment any of your questions. Always welcome. So the first non-bedside nursing job, nurse entrepreneurship. This is something that I quit nursing, didn't know I was going to go into, and then life unfolded that way. Nursing entrepreneurship is absolutely incredible. One, you know the nursing population. You know what makes them tick. You know what it's like to be a registered nurse. You can talk to nurses as an audience and healthcare workers as an audience. In whatever you choose to do in an entrepreneur, I'll give you some examples. YouTube, obviously, you can do that. YouTube is actually really great for generating conversation into whatever service or product that you're providing. You could be a blog writer or you could be a copywriter. Nursing copywriters, I don't know enough about it, but I do know copywriters are very high paid if you become good at it. It's a skill you can master in 1 to 2 years. But being a nurse, you could be a copywriter for many blogs and you can make a very good income off of that. And I have 2 friends, Emily and Ryan. They are a perfect case study of what you can do as a nurse. They're both travel nurses and they picked up COVID assignments. And while they were doing this, they were also starting their app, MedVenture. This app's completely free. It's for travel nurses. They have loads of resources, including facility reviews, so you know what the hospital's like before you jump in. It's not a dating app, but it's like a dating app. You can swipe to find fellow travel nurses in your area and become friends with them. And they also have a Facebook community, and they also have webinar events, so you can always be upping your game as a nurse and live a more fulfilling life. Go ahead and check that out. It's free in the App Store. The coolest thing about entrepreneurship as an RN is you can be your own boss. Now, there is a caveat. It is extremely hard work. If you think being an RN is hard in terms of the physical and mental toll, being an entrepreneur, you have to have true grit. You have to be able to wake up without somebody at your back saying you're not going to get a paycheck today. You have to be your own boss, and you have to be your own manager. So that is always an option. Number 2, you can be a donor nurse. So you would still work in a hospital, but you would work for a donor association and they would train you. Donor nursing is pretty cool because you are coordinating all of the events that are going on in order to procure this patient who decided to donate their organs. In order to procure these organs in a timely manner, you are managing all of that. And it can seem like a pretty stressful job, but compared to bedside nursing, I saw the donor nurses, they're working with one patient. They're following protocols and order sets in order to protect the organs that are going to be transplanted. There is still an aspect of bedside care. You're not going to be lifting patients or anything, but you are going to still be interacting with family members, which can be very hard, but you play a pivotal role in helping family members make a decision if they want to or if they don't. Potentially save somebody's life, the kid that needs a liver transplant. You are going to be the person who is directing and maybe even convincing people to help. It's from what I've seen, it's an extremely rewarding profession. I believe you get paid slightly less than a bedside nurse, and medics can go into this career path as well. Number 3, cruise ship nursing. Yes, this is the thing. You can work on a cruise ship or in a resort as a nurse. I definitely don't think the pay is as good as bedside nursing, but you get to work on a cruise ship and travel the world. Sounds pretty cool to me. Number 4, resort nursing. You can work at a resort. At some resorts, they're going to need a nurse on hand because people are getting drunk and injured. Yeah, I don't know enough about resort nursing, but it is an option out there. Number 5, you can become a CPR and ACLS instructor. You would be responsible for teaching people CPR and ACLS. I don't think the certification and the amount of education you're going to have to do is going to be strenuous. From what I've seen at my ACLS courses, it's pretty chill. Number 6, this is still a bedside profession, but it's far less stressful, so that's why I threw this in here. Wound care nursing. A wound care nurse, from what I've seen in California, they see about 6 patients a day. Very similar to regular bedside nursing in the sense that they're still assessing the patient, looking at the wound, all of that jazz. But one of the really cool things that I saw with wound care nursing is they are directly working with the doctor. The doctor comes in and basically tells them what they need done, and they're in the room with the doctor. They get to hear what the doctor is telling them. So the nurse becomes very educated themselves. They pretty much become like the doctor. The problem with wound care nursing is the patient population often is very difficult. Many of them do not follow through with your instructions. Their own self-care routines are non-existent, and so you give them a bunch of information about why diabetes is causing their foot ulcer. They don't change that. They don't take care of the wound. It gets worse. So that is the one complaint I've heard about wound care nursing. Significantly less work with running around and lifting patients. You bring the patient to the room, you view their wound, assess them, talk with the doctor, treat the wound, and then on to the next patient. Number 14, and you don't even have to be a nurse to do this, but nurse recruiting. I don't know enough about nurse recruiting, but I do know that they would be very happy to hire RNs because you understand the patient population, and you would be able to recruit much better. You would be responsible for reaching out, marketing, and finding people to come to the hospitals that the service is providing. Education. Now, I will say this, if you want to work in a school, I'm pretty sure you have to have an MSN, but you could be a preceptor at a school. You could work for the school and be a preceptor, and you don't have to have a master's in nursing. On top of this, there are also companies that will hire you to give education to the community. So for example, they have a bunch of patients who are obese and they need them to manage their weight in order to decrease medical costs. It could play a pivotal role in the education of this patient population. Number 12, leadership. Now I believe if you want to go into any of these roles, it may require a master's degree. Comment below if you know the answer to that. You can be a manager, a CNO, a director. I personally couldn't do any of this. Management, the burnout rates with management are very high as well because you're getting sandwiched between the staff and your higher ups, the administration. Really hard job. Kudos to you managers out there, especially the ones that are really advocating. It's a very, very difficult profession. But there's a calling for some people out there. Are you struggling with burnout right now? If you are, go ahead and book a free stress less call with me, myself, and I. We will have a 30-minute conversation about what's going on in your life right now and what changes we can make to your self-care routine in order to help you sustain this career for the long haul and live the life you truly want. You can book a call in the link below. Number 10, home health. The cool thing about this is you are still technically a bedside nurse, but you're at the patient's home and you have more autonomy. You also have more one-on-one interaction with the patients. Anyone who knows this, correct me if I'm wrong, but I also don't think the charting is as complicated as being a bedside nurse. You have your little iPad and you're able to document with the patient right there. And when I did my home health rotation in school, it seemed like a fairly simple and rewarding profession because you directly build relationships with these people and you see them every week. Versus if you're working in the emergency department or the ICU, you're going to see the patient for a couple days and then they're gone. But with this, you get to build a long-term relationship and you get to help your community. You also have the option of pediatric home health, which would be absolutely amazing. Number 11, risk management. A bachelor's degree is required. You are going to basically facilitate change in the hospital by measuring the amount of sentinel events that are occurring in the hospital and the risks and how to reduce those risks. So one example are patient falls. If somebody falls in the hospital, you would probably hold a meeting for education about how we can prevent this in the future and what new policies and regulations have to go in place in order to prevent this from happening. Number 12, and a lot of people are scared from this, correctional nursing. So you could work in a jail, and I believe the beautiful benefit of this is you get a pension because you're working for the government. And contrary to common belief, more violence actually occurs in a private healthcare facility, i.e. the emergency department, than does at a correctional nursing facility. The patients in the emergency department will throw punches at you and kick you. It does take a certain kind of person to be strong and not let these kinds of people take advantage of you. But for the most part, you are helping the people who are pretty much hated by society. I remember I was riding my bike one day and there was this prison that had a really nice view, and one of the guys said, he spit on the ground and he said, those rats get to enjoy that view and they're all pieces of shit. He was talking about inmates, and in my opinion, not all people who committed a crime are still terrible people. People can change, and some people are wrongfully sentenced to prison as well. So you could play a huge role in helping inmates if that's your thing. Number 13, research nursing. This specific role is basically helping doctors with clinical trials, vaccinations, and studying it. This is a huge role in our society for the advancement of medicine and technology. Number 14, a bachelor's degree is required. Clinical case manager. So you are basically the manager for patients, and you are helping facilitate discharge, where they're going to go next, pharmacy stuff. It's a pretty cool position because you are not at the bedside, but you are still working with nurses at the bedside, and you are still working with those patients. And you can also find jobs like this within the community if you don't want to work in the hospital. Number 15, and this is a fan favorite, psych nursing. Psych nursing is technically not bedside nursing. And in my psych rotation, I didn't have a calling to do psych nursing, but I did have a lot of fun with the patients. Mental health for me is a very fascinating subject that needs to be talked about more. The psych patients for me were amazing. They were just like pretty much normal people, but they just heard voices in their heads. And you're going to be giving these patients medications, you're going to be talking to them and trying to calm them down when they're having mental health breaks. And many nurses who I've talked to have described psych nursing as far less stressful and fun. Number 16, this is a bedside job, but it is very low stress. Dialysis nursing. When I was working in the ICU, the dialysis nurse would come every Monday, Wednesday, Friday, depending on the patient's dialysis schedule, and they would dialyze the patient. All that requires is they take a set of vitals and they monitor the patient, and they do whatever they need to do in terms of the machine and changing bags in order to make sure the patient's dialysis goes smoothly. This job is really easy because if any problems occur, the dialysis nurse calls the nurse who is assigned to this patient, and the nurse takes care of it. The dialysis nurse only has one job, and that's to dialyze the patient. But I would say it's a pretty boring profession from what I've seen. The nurses are generally sitting there on their phone all day. I wouldn't like it, but if that's your thing, if you want something chill where you're still getting paid well, dialysis nursing. Number 17, telemedicine and telephone triage nursing. If you've ever been sick, maybe you got a UTI or something, you call the doctor and they will often put you on the phone with a nurse, and the nurse is going to basically assess what your symptoms are and identify and basically triage you, identify what you need to do next. This is a cool profession because you can work on the phone. I believe most places require you to be at a call center. As companies evolve, I believe there will be more opportunities for people to do this from home. Number 18, forensic nurse consultant. This is a pretty awesome and rewarding job. I've never done it, I've never seen it, but forensic nurse consultant is basically the person after a terrible event occurs, such as domestic violence or rape. They are there for the patient. They have to do assessment and sampling in order to provide evidence in a court of law. This job would require a very special person. You are dealing with some pretty dark stuff in society. But with that being said, you get to provide light to the people who were victims to these terrible events. Number 19, school nursing. You can be a nurse at an elementary school, middle school, high school, and you can help students. You have a lot of autonomy as well because you are the only nurse on duty. So you do need to know about specific events like seizures or allergic reaction. This is something you'll have plenty of time to study, and there will only be so many scenarios that can happen. School nursing sounds pretty cool, especially if you like hanging out with kids. Number 20, the least interesting to me, but to some people very interesting, nursing informatics. You are basically the coder for medical technology. You are the nurse who makes sure that the systems, such as charting systems, etc., are working and in place in order for nurses to provide good documentation. Nursing informatics does require a bachelor's degree, and I believe it also requires a certain amount of hours. But in order to get a certificate, you have to have like 1,000 to 2,000 hours of practice. And I believe in nursing informatics, you have to have 2 years of experience before jumping into it. To wrap things up, these are the 20 non-bedside nursing professions you can jump into if you need a change. With that being said, I want to tell you, if you're burnt out and you feel like crap, you only get one life. So put in a little effort now and identify a better career choice for you, because It's pretty terrible to put in all this work as a nurse and then you basically quit and go do a completely different profession. Now, if that's something you want, that's great, but nursing is so diverse. There are plenty of opportunities for you to find a transition that works for you. If you like this video and it helped you in any way, please go ahead and subscribe and hit the like button. It helps me spread the message of what I'm trying to promote here. Wellness for healthcare professionals during these troubling times. Go ahead and check out these 2 videos here. They will help you as well. Thank you so much for watching as always. Stay strong, Healthcare Squad. Ciao.